Hi, in this particular video, we will discuss the cardiovascular changes and respiratory changes during muscular exercise. So, let's first understand the types of exercises. In some previous video, we have discussed the types of muscle contractions. You know, there are two types of muscle contractions, isometric contraction and isotonic contraction. So, even exercises, muscular exercise can be of two types, isometric and isotonic exercise. Let's just recall when we discussed isometric contraction and isotonic contraction, what did we mention about it? Isometric and isotonic, two types of muscle contractions. When we said muscle contraction means two things happen in the muscle. A, tension is generated in the muscle, and B, muscle shortening happens. So, these two things put together cause the muscle to contract. I mean, that is what happens actually, tension generated and shortening of the muscle. That's the muscle contraction. So, when we say isometric contraction, what does it mean? One of the two things are happening. Isometric means length remaining the same. That means what? No shortening of the muscle happens. Length remaining the same. Muscle does not shorten. So, what is the other thing that is happening in the muscle contraction? Yes, tension generated. So, isometric contraction means only tension generated in the muscle, no shortening. That's isometric contraction, isometric type. And what is isotonic contraction? Isotonic, that means tension remains the same in the muscle. That means what? After a certain tension is developed in the muscle, that tension will now remain the same, it will not change, and the muscle shortening will happen. Remember, a contraction means two things, tension generated and shortening of the muscle. So, isotonic contraction means after a certain tension gets developed, then that tension will remain the same and now the muscle will start shortening. So, shortening occurs during the isotonic contraction. Now, if you look at the any type of lifting of a load, suppose it's a very heavy load, initial part is always isometric. I mean, imagine you are lifting a very heavy load from the ground and trying to now contract with the biceps, I mean trying to lift it with the biceps. Initially, only tension gets developed in the muscle, but shortening does not start. So, only tension getting developed means that part of the contraction is isometric contraction. Only tension is getting developed, but muscle shortening hasn't started yet. And then, after a certain amount of tension is built up in the muscle, which is good enough to displace that load, then the load starts getting displaced because the muscle shortening starts. Now, the tension will remain the same and muscle shortening will happen and the load will be displaced. So, that part is isotonic contraction. That means, when you are lifting a moderate to heavy load, it always is a mixture of contractions. Initial part always isometric and later part is isotonic. It's a mix of two. Now, with this background, let us try to understand the types of exercises. Exercises are of two types. Isotonic exercise means the one in which muscle shortening is going to happen. So, all the running, jogging, cycling, swimming, aerobic type of exercises, aerobics, running, jogging, cycling, swimming, etc. These are all isotonic exercises because there is shortening of the muscle happening in these types of contractions or these types of exercises, isotonic exercises. Basically, low intensity repetitive types of contractions happening in these exercises. So, they are also called as dynamic exercises. These are also called as dynamic exercises, whole body exercises, dynamic exercises. The second type of contraction and therefore second type of exercise is isometric exercise. Remember what we said about the isometric exercise? Sustained tension and only tension development, no shortening of the muscle. What are these types of exercises? Well, the weights and the pulleys, these types of exercises basically are called as isometric exercises. If you just imagine that you are pulling down a pulley and holding it, hold the pulley like this with the weight attached. What you see is there is a sustained tension that is getting developed in the muscle, but there is no shortening of the muscle. Shortening would be displacement of the load through a certain distance, whereas here you pull the pulley down and hold it. If you see biceps, it has got a sustained tension but hardly any shortening. So, sustained tension development without shortening of the muscle, that is isometric exercise, also called as static exercises. These are mostly the static type of exercises. So, weights and pulleys, pulling the pulley in different direction, in different ways, these are the isometric exercises. Now, with that background, let us try to understand the various changes that happen during these exercises. Cardiovascular changes during different types of exercises. Let us first see the isotonic or dynamic exercises. What will be the cardiovascular changes during isotonic or dynamic exercises like running, jogging, cycling, swimming, etc., the aerobic types? First thing is that there is increased stroke volume, there is increased heart rate. You know, these whole body exercises, what they cause is that they increase the sympathetic activity, they increase the sympathetic discharge. So, increase sympathetic discharge to the heart, leading to increased stroke volume, the amount of blood pumped out by the heart in one systole, and also the number of beats per minute, increased heart rate, and therefore, the product of these two, stroke volume and heart rate, is the cardiac output. So, there would be increased cardiac output. You know, the normal cardiac output is about 5 liters per minute, but in a non-trained person or non-athletes, it can increase up to 25 liters per minute. The blood will circulate 5 times faster, so to speak, and in an athlete with a higher stroke volume, the cardiac output can increase up to 35 liters per minute. So, cardiac output increases even in untrained people or non-athletes, and in athletes it can be 7 times higher than the normal cardiac output. So, that is one. Now, what happens with blood pressure? This will be important to understand. What is the effect on blood pressure? Let us just try to understand this with the help of a graph. It will make us remember for a longer duration. If we look at the graph, a simple graph, the effect of exercise on blood pressure. So, this is blood pressure and this is time into exercise. Now, if we look at systolic blood pressure increases as we perform this exercise. But what happens to the diastolic blood pressure? Diastolic blood pressure remains the same or slightly decreases. So, let's summarize. Systolic BP will increase as you perform the exercise, and diastolic BP will slightly fall, it will slightly decrease, and therefore pulse pressure, the difference between the two pressures is called as pulse pressure. It widens, as you can see from the graph. At the start of the exercise, this was the difference between the two pressures, and it has widened as the exercise was performed. Now, let's try to understand why this change has happened. Systolic BP increases, quite understandable, because we have already said there is increased sympathetic drive, to the heart, and therefore there is increased force of contraction of the heart, and systolic BP will increase. What about the diastolic blood pressure? Diastolic blood pressure decreases. Now, let's try to understand this. Why diastolic blood pressure decreases? First of all, let's recall that diastolic blood pressure is indicative of the peripheral resistance. And most of the peripheral resistance, more than half the peripheral resistance is offered by skeletal muscle circulation. You know, something like this. Here is a muscle and here is a blood vessel within the skeletal muscle. Now, muscle is a contractile tissue. It keeps on contracting all the time, and therefore the blood vessel inside would be compressed, and if the blood vessels are compressed in this manner, there would be increased resistance to the blood flow, and therefore peripheral resistance, more than half of the peripheral resistance is contributed by skeletal muscle circulation. Skeletal muscle vasculature mainly contributes to the peripheral resistance. So, imagine if these vessels were to dilate, the peripheral resistance will decrease, and peripheral resistance is indicated by which blood pressure? Diastolic blood pressure, and therefore diastolic blood pressure will actually fall. So, what happens here is, let's just summarize it, that with the exercise, these exercises, there is something called as muscle chemoreflex. That is, the exercising muscles, they release certain chemicals, CO2, H plus, lactic acid. These chemicals which are released by the exercising muscles, they are known to be dilators. They will cause vasodilation. They cause vasodilation locally in the skeletal muscle. Where they are released into the muscle, they will cause local vasodilation, and local vasodilation will result in a decreased peripheral resistance. We have already mentioned this, that the peripheral resistance is mainly contributed to by the skeletal muscles vasculature. So, if that vasculature dilates, the peripheral resistance will fall, and we have also mentioned that peripheral resistance is indicated by diastolic blood pressure. So, there would be a decrease in diastolic blood pressure. Now, the clinical application of this is that therefore, these exercises are advised in hypertensive individuals. hypertensives are asked to perform such aerobic exercises, low intensity repetitive types of contractions or exercises, because hypertension is mainly labeled on the basis of diastolic blood pressure. I mean 85 to 89 diastolic blood pressure is said to be high normal, then 90 to 104 is mild hypertension. So basically, and I'm talking about the diastolic blood pressure, of course. So more than 90 diastolic BP is taken to be the hypertension. The point is, hypertension is labeled on the basis of diastolic blood pressure. Now these exercises, they decrease the diastolic blood pressure, they reduce the blood pressure, and therefore they are advised in hypertensive individuals. We will see that isometric exercises, these are isotonic, but isometric exercises are somewhat contraindicated in hypertensive individuals because they are known to increase the diastolic blood pressure. So let's see the isometric exercises. These were the changes in isotonic exercises, dynamic exercises, aerobics. Now let's see the cardiovascular changes during isometric exercises. As I have mentioned, isometric exercise means there is sustained tension development in a muscle or in a group of muscles. So, sustained tension development without shortening in a group of muscles, and if it is a sustained tension development, then there will be a sustained compression of the blood vessels inside the skeletal muscles. Sustained compression of the skeletal muscle vasculature because of the sustained tension development in those muscles. Remember, that is the key difference between isotonic and isometric exercises, aerobic exercises versus weight training or pulley exercises. The key difference is, in those exercises, aerobic exercises or running, jogging, cycling, etc., there is alternate rhythmic contraction and relaxation of those muscle groups. When you are performing the exercise like running and jogging, etc., the muscles are contracting and relaxing alternately, rhythmically. So, the muscles are relaxing, then contracting again, then relaxing. When the muscle relaxes, it will allow the blood vessel inside the muscle to open up, dilate. Whereas in the isometric contraction, the weight and pulley type of exercise, if we are assuming that there is a sustained tension development, that means muscle is not being allowed to relax. Sustained contraction or sustained tension means there is sustained compression of the blood vessel inside those muscles. So that means those vessels, those blood vessels within the muscles are not allowed to open up, not allowed to dilate. They are encountering a sustained compression. It means what? Sustained compression means sustained vasoconstriction and increased peripheral resistance. Remember, we said this, skeletal muscle blood vessels, they contribute mainly to the peripheral resistance. And if there is increased peripheral resistance, there is increased diastolic blood pressure. So, as I mentioned previously, since hypertension is labeled on the basis of diastolic blood pressure, and these exercises increase the diastolic blood pressure, they are generally not advised in hypertensive individuals. If I were to draw a graph for isometric exercise, how the blood pressure change will happen, and compare this with the graph that we had drawn for isotonic, there is increase in the systolic BP. Yes, it would occur. There is going to be increased sympathetic drive to the heart, and there is increased diastolic blood pressure as well. Remember the previous graph, this is isometric exercise, sustained tension development. So, both blood pressures are going to increase, and that is our isometric exercise and changes that happen there. If there is increased diastolic blood pressure, even the mean arterial pressure will increase. Mean arterial pressure. Mean arterial pressure mostly is slightly closer to the diastolic blood pressure. Mean arterial pressure is calculated like this: diastolic blood pressure plus 1/3 of pulse pressure. So if the diastolic blood pressure increases, the mean average pressure also will increase. Heart rate increases slightly, but not much of a change in cardiac output. No change in the cardiac output, because if there is a sustained contraction of the muscle groups, that means the blood coming into those muscles will decrease, and the blood going out and blood returning to the heart, the venous return to the heart, will also decrease in these exercises. And if the venous return decreases, you know the Frank-Starling law, less the venous return, less would be the stroke volume. So, heart rate might increase, but stroke volume might fall, and therefore the product of these two, that is cardiac output, will remain more or less stagnant. Remember, in isotonic exercise, cardiac output was increasing. It was increasing as high as 25 liters or 35 liters per minute. But in isometric exercise, there is hardly any change in the cardiac output. Slight increase may be seen, but not much. And that's these are the changes, cardiovascular changes during different types of exercises.